This is a KX News special report.
Good afternoon. Welcome to today's press briefing. Today, the North Dakota Department of Health confirmed 17 additional cases of the novel coronavirus disease, or COVID-19, putting us at a total now of 126 cases. This is our second highest day with 17 new cases. We continue to have good, positive progress on testing, testing 384 individuals since yesterday, and there have been some questions about how we're doing versus other states. These numbers are fluid because people report testing at different times of the day, but North Dakota remains in the top 10 of states on testing per capita, and our intention is to stay in there and keep moving our way up that chart, because we know that testing and more broad testing is one of the ways that we work our way not only through the crisis, but out the backside as well, in terms of helping us get back to the new normal after this. There have also been some questions related to testing by counties, and one of the things that is come up on that is there's been a concern about how we're doing testing around the state. As you can see, we do have tests completed again in all but 2 counties, and we've done a lot of work up in McKenzie County and Williams County, up in that area, and we'll provide going forward some data on testing per capita. But while these may seem weighted to the metro areas on a test per 1,000 people, these are actually it's probably quite evenly distributed across the state. I think the main curve that we want to show on the slide, which shows that our cumulative tests going back up, the key point on this is that the curve is still going up. I mean, this is the message every day, which is that we are, some people might ask, when it's going to be over, and we'll know more about when it's going to be over when we know we've reached the top and we're starting to go down the other side. But for right now, as was predicted, we're continuing to see this grow. And again, the key messages here is that on the testing, there's a lot of focus on the testing and the focus on tests by county. But for everybody listening, again, we have to assume 2 things. One is that this data reflects people that got sick at least 10 days ago and are now testing positive now. And it also reflects that we're not catching everybody that has the coronavirus, because some people do experience milder symptoms. And when you experience milder symptoms, you may be doing okay, but you can still be contagious. You can still give it to other people. And so again, we know that this may represent only 1 in 10 people that have it. So we should be thinking about the fact that there could be, over 1,200 people in the state of North Dakota that had it 10 days ago, and that number is climbing. And so again, this is all very lagging data that when we're looking at the positives. And if you're want to get a view of what some of the futures are, you can go to other states and take a look at the day when they got to 100, and then take a look at the day when they got to 1,000, and you can see when those curves were climbing how fast some of this spread. Now in North Dakota, because we were proactive in putting in a number of guidance about physical distancing, then in that case, then we, maybe you've got a chance to have a flatter curve than some other states. We're certainly working hard to make sure that we don't end up like Italy or someplace else. So we want to make sure, again, our goal is to flatten that. I want to highlight again the recommendations that we're giving for people in terms of how to slow the spread. And for those of you that are regularly attending or regularly watching, this is going to sound very repetitive, but we did last night have a call with all of the presidents and leaders from the large hospital organizations across the state. Those include our large independents like Trinity and Altru, and then those organizations that are part of larger systems, like whether it's CHI, Sanford, and Essentia, and the number of locations they have. We talked to those leaders last night, and they again said, hey, will you keep getting the word out just like they are about how to slow the spread as they work diligently to try to convert floors and prepare for the surge, as we call it, when we may have a large number of cases. Earlier today, we had about an hour and 45-minute call with the 36 critical access care community in North Dakota, and that includes hospital presidents, local physicians, heads of nursing. And on that call, again, we were implored by that group, especially by those from counties where they may only have 1 or 2 positive cases. They were saying, please get the message out about what we need to do to slow the spread, because their feeling is that people are not taking it seriously until it's at their doorstep, till they know someone who is sick. And again, if you take a look at New York, by the time you know somebody that, if everybody has to know somebody that's sick before they take it seriously, then you're in the situation that New York is, where things are going straight up. And as we just see there, they are building and filling hospitals in civic centers. This is something that we don't want to have happen here. So again, whether washing your hands, keeping physical distance, staying at home, if you're not feeling well, these are all the basics. But again, we want to make sure that you're practicing that, and everybody that is practicing this good discipline is helping to save lives, and anybody who's not is actually potentially endangering lives. Happy to report there was no new deaths today in North Dakota. On Saturday, we talked about our hospital surge plan with 3 tiers. And again, those 3 tiers are, number 1 is what's the capacity we have right now that's available. Tier 2 is how do we convert spaces that might have been used, say, for elective surgery into places where we could be housing COVID patients. And Tier 3 is when we're actually bringing online capacity that doesn't exactly exist, but if we're fortunate in North Dakota with our hospital expansions that we have gone on in the last few years, that we've actually got space that in just recently, a year or two, in good space that was, maybe better than some other states' current space. We've got places that we could convert back into hospital space. When we've had a chance to talk today, we had calls with the Region 8 director for FEMA. I know we've got a group from Army Corps of Engineers that's in the state evaluating Tier 3 locations today, and also Lieutenant Governor was on a call with Region 8 EPA. So anyway, there's a lot of coordination with federal about how do we build that Tier 3 capacity, like other states are already into their Tier 3 and got hit with it before they even had it completed. But again, with all of your help, the goal would be that the Tier 3 for us, that the temporary hospital capacity is stuff we never have to set foot in. The goal would be that we're ready if we need it, but with managing and slowing the spread, that we can best care for our citizens in that Tier 1 and Tier 2 space. But when we talked about those levels, it's not just about beds, it's about beds plus equipment. Equipment means ventilators plus PPE, but it also means qualified staffing. And so we know that going into this thing, before we even got into the whole COVID crisis, we were short of healthcare workers in our state. And so today we're announcing that we're activating the Workforce Coordination Center, and it's there to serve emergency workforce needs in support of this, which affects lifeline services for providers, industries, and agencies. We've got a again, the whole of government, whole of community approach to this thing. Job Service, Department of Health, Department of Labor, the National Guard, the North Dakota Information Technology Department, Human Resources Management are some of the groups that are involved in getting this set up. But when we go from Tier 2 to Tier 3 hospital capacity, we got to have resources that are lined up. And some of our larger system providers have already done this, where they've identified sort of this on the bench people that are outside their existing workforce that could potentially come online. We want to build on that and do that statewide. And so this is a message to the citizens in North Dakota. If you're willing to help, and if you've got experience in healthcare, public health, law enforcement, public safety, if you've been a first responder, if you're qualified as an EMT, but you're not currently working in any kind of role. with the rural ambulance system or in our metro areas, we need volunteers to help at emergency shelters, congregate living facilities, and drop-in centers, childcare, food and agriculture, communications, energy, water and waste management, critical manufacturing, a whole range. And some of these jobs will be paid. Some of them are volunteer jobs, but whether you're just someone who wants to say, hey, I want to help out, help my neighbors, how can I do that? And can I do that working from home, or can I do that volunteering with the right kind of PPE if it gets to crunch time? We're looking for both volunteers and paid staff. And this location will pool all applicants and then match up the needs of the businesses or agencies that need their help. And so again, this Workforce Coordination Center is there to help facilitate for the businesses. If businesses in North Dakota need help for workers related to this, we can help do that. And again, we talked every day here about people that have been in unemployment either because of the collapse in oil prices or because of mandatory closure of businesses or because of demand drops. But I do want to remind people as well, in addition to the Workforce Coordination Center for people that are looking for either paid or volunteer ways to contribute, that there are still businesses that are hiring. So again, at jobsnd.com, you can go there to look for a job, not just go there to apply for unemployment, because we know that there are, during this shift, say from online, from on-premise to online retail, the shift in business models, there are some businesses that are growing rapidly and looking to hire, and we encourage people that want to work to check that out at jobsnd.com. The other plug which I want to put in here for General Dorman, again, before going into this thing, we have, we feel we've got the best National Guard in America right here in North Dakota, and the National Guard was hiring before. We're definitely hiring now, and so again, if you are interested in a great career with incredible benefits, nationalguard.com or 1-800-GO-GUARD. Either call either of those places or put your name in and someone will call you. But, great careers. And right now, of course, the National Guard doing great work supporting us here in North Dakota. So thanks out to everybody who's part of National Guard. Next update has to do with hand sanitizer. We know that the shelves have been bare for a week. I'm sure that many people have got a entire multi-year inventory at home, but the shelves are bare. We know the national manufacturers are working hard to meet demand, but we're not just waiting for that. We have some vendors in North Dakota, including those people that are in the alcohol business, because hand sanitizer is primarily alcohol, is what's the agent that kills the germs. Anyway, we've got vendors that are working on solutions, producing it in bulk to be pushed out to healthcare facilities first and then retail later. We'll have more details on that, but there is no bottling facility in North Dakota for hand sanitizer. So even though we're able to produce the actual sanitizer in bulk, if people have and are going through your hand pump, squirt nozzles, bottles that you have at home for as you burn through those, save your plastic bottles, because we may have a way to have you be able to refill those, because we'll have hand sanitizer, but hang on to your little dispenser devices. Next topic, schools update. As you know, we restricted access to schools on March 15th to essential staff only, and directed districts to develop age-appropriate distance learning plans. Those plans were all submitted on time by March 27th. Goal was to have everybody up and running by tomorrow. We're making fantastic progress on that, and again, thanks to every school district that met the deadline of Friday. Over the weekend, a number of those plans, we gave feedback and asked people to go round two or provide more clarity, and in terms of real clarity particularly around teacher expectations and student expectations. So a number of those have come back in again, and now as of 3 p.m. today, we'd approved 155 of the 175 plans, but that covers more than 98% of the students and 98% of the state aid, because state aid was was distributed to that. That remaining 2% of students in state aid, we're going to continue to work through this evening on those plans, where we believe that we'll have everybody up and running by tomorrow. And there may be a few districts that have got a little additional homework to provide some more clarity, but our goal is to have every student be back tomorrow. And again, I want to thank all of the districts, all the superintendents, all the teachers, everybody that worked their super hard work. And I know I speak on behalf of a lot of parents that I've heard from, which is they're excited for that distance learning to start happening for their students that are at home. And also, I'm also hearing great things, that some really creative and innovative things are happening in terms of how that is being delivered. And so again, congratulations to everybody, and thanks to the private sector partners that may have helped contribute devices or helped out on bandwidth. But all of that is fantastic. And again, to think about that we've taken over 110,000 students and in just 12 days turned that around to a distance learning thing, I think just shows you what North Dakota is capable of. So way to go K-12, and way to go team, way to go DPI and all the people that worked on reviewing those plans. And shout out to Maria Nesset on our team, who also worked really closely with DPI to review all of those submissions. And again, to be clear, while we're opening for distance learning tomorrow, we're not reopening schools for student instruction until further notice. Students will be learning from home or in their other setting tomorrow. And again, kudos to some of those districts that have already started. Some I know started as early as Monday, started doing the distance learning. And so that's fantastic. Related topic. There have been, all kinds of rumors floating around, and this is what I'll call, as I said before, the only thing that goes faster than the virus is bad information. But certainly the shift from people working in offices to working at home, and from doing schooling in a building to doing schooling at home, pushes the needs for bandwidth in our state, because it shifts it around. So there have been a lot of stories, that we're going to have the national internet's going to crash. That hasn't happened yet. We know that some people came online this week without any issues. We know that on the day that we took 7,100 state employees and moved them all starting from working from home, that we did have a temporary issue for 45 minutes with the 324 numbers, prefix numbers that were state government numbers, because the providers, the CenturyLinks and the Verizons, all those guys have got capacity, but they would shift that capacity from home use to during the day. But anybody that understands network traffic knows that there is the data associated with email or phone calls is nothing compared to streaming video content. Our nation's system is built for Netflix and Hulu and Amazon and everything else, and everybody watching movies at night. And so one thing we do, if somebody is having an issue with streaming, during work hours, again, I would just, everybody check your devices and make sure that you're, prioritizing your bandwidth use for schoolwork during the day or for your work from home approach. But we also are pleased that in terms of North Dakota, we've been working on this the state's been working on this in a private sector partnership for some time, but North Dakota's got one of the most robust backbones in the country from a internet traffic standpoint. We upgraded every school in the state just this last July. We were one of the first states in the nation to have 1 gigabit minimum to every school, but now we've got a 40 gigabit backbone to every school facility, and we've worked with partners to add an additional 200 gigs to the backbone across the state, and we brought that up 2 weeks ago. So in anticipation of this, we've tried to really step up the bandwidth that's available. But again, thank you to all of the private partners and the carriers like the Dakota Carrier Network and the telecom companies I mentioned earlier for all of their great work. Unemployment, next topic. Claims filed on Monday, 2,803. Total since March 16th, 24,667. Claims so far today, 1,401. As we said earlier, on the claims since March 16th, the 24,667, we're comparing that, as we did yesterday, to all of 2019 was 20,500. So we've surpassed since the middle of March, in the last half of March, what we did in a whole year. So that brings to the end of the formal remarks, and we'll stand for Q&A.
Governor, do you know if they're mostly smaller schools that are not ready to go yet in terms of the distance learning?
Question from radio legend Dave Thomas was, do I think it's mostly the smaller schools? It's been a while since taking a math class, but from reviewing what I said earlier, if we got 20 districts left that represent only 2% of the students, the answer to your question is yes. The ones remaining would be smaller districts.
Just to follow up on that, do you expect all of the districts to start tomorrow, even the ones that haven't yet been approved?
Yeah, the answer, yes, we expect all the districts to start tomorrow.
Governor, when you were talking to the schools and going through these plans and sending some of them back for clarification, what were the more common things that needed to be clarified?
Well, I think again, as I said earlier, the most common thing was really being clear about student expectations and teacher expectations. And some folks have got the submitted plans, some folks, some districts, very, very clear descriptive, by English, by math, by science, by kindergarten, by first grade, by second grade. So it was really how well they'd flushed out the specific learning goals and objectives, and then how they're going to accomplish those learning goals and objectives. And of course, some districts had got more resources, had spent more time thinking about it. Some had thought about it, even before we got to this whole COVID crisis. Others may not. So there are a lot of good learning and a lot of good sharing going on between all the districts. And I would say that everybody's in a better spot than they were 3 weeks ago relative to distance learning. I mean, there's a lot of learning that's gone on and a lot of great work that's gone on. And I just say again, having the teachers and the administrators continue to work on this while the students were, during those 12 days where we waived the school days, a lot of great work was done. And again, I'm excited for the students in North Dakota to get back to school tomorrow. Amy?
Yeah, Governor, you, when you were talking about the Workforce Coordination Center, do you all have a feel for how many people we're talking about either potentially hiring or potentially needing to volunteer?
Questions are, what do you think about with needs? I think that the primary thing that we have to try to model in that is at the very worst case scenario. I mean, in the worst case scenario, we're saying, if we need to add another 4,000 beds on top of all the beds that we have in North Dakota, and then how would you staff that? And then how do you staff it for 24 hours a day? And then how do you staff if that involves then moving people, say, out of one facility when they're coming off of a ventilator and they don't need as much intensive or critical care, and we can move them to a facility that doesn't offer that, to a step-down facility. We need transportation. We know that already, particularly in our rural areas, rural ambulances are really thin on staff. And so I think that we're talking about thousands of people that we're trying to identify statewide. Now, if everybody volunteers and everybody steps up, and that's great, and then we use some of them but not all of them, that's fantastic. But again, we don't want to be in a spot where other states and other countries have found themselves, where the patients are coming faster than they can locate people. We have the time to try to get everybody on the bench that wants to be on the bench, that wants to raise their hand to be ready. So we got their contact information. We know what their skills are. We know where they live. We know how quickly we can deploy them in which geographies. And this is just all really excellent resource planning that we're doing, and it's necessary because we can't just go out and build beds and then not make sure that we've got staffing needs to do that. And in the case of, again, when we talk about things like, child care, if we got somebody who's a CNA but they're taking care of kids, because I heard that on the phone today, that we had some of these health organizations have had to stand up their own child care to make sure their people could come to work. Well, if we can backfill and help on child care, then we can get other, people working at the highest at their highest level of licensure is where we want people to be working. And of course, we may also identify, as we did on the call today, one of the folks on the call today works in hospital administration, used to be a respiratory therapist, saying, hey, how can I get, my license back again? And we want to keep working with licensure boards to make sure we're getting people back ready to get on the court. I'm using basketball analogies, but we got to identify who's on the bench and get ready to put them in the game. Lane?
We had a couple of viewers wondering if there was any updates on food stamps and their deadlines.
Questions, update on food stamps. I don't have any updates off the top of my head right now, but I'll through the course of this, I'll see if someone can find an answer, and if not, we'll come back to you with an answer. I'm going to go over here to an online question next, if I can, Jeremy. Danny?
All right. April Baumgarten with the Forum in Fargo. At least one health system in North Dakota has suspended elective surgeries, while others said they would continue. As other states, including Minnesota, order a halt to elective surgeries, would you consider signing a similar order?
Question, would I consider signing an order similar to Minnesota to halt elective surgery? The answer right now is no, and I'll tell you why. Because as we just described, we talked to all the large hospital organizations last night that are doing everything they can. They're winding down their elective surgeries, and people are electing to not do truly elective things during this period of time. But we also have to manage right now. I mean, I think we've shared before. I mean, we're still, the hospitalizations related to COVID in the state of North Dakota are I think in the 20s in terms of number of people hospitalized. But what this is doing to our hospitals' financial system, I mean, hospitals serve people who are critically ill, but one of their biggest revenue streams is elective surgery. And depending on how you describe elective, if somebody has a compound fracture, I guess that's not elective. If somebody, needs a cancer treatment, that's not really elective. So we want to be clear that there are some functions that we want the hospitals to continue to do right now, because the stuff that they're doing is also improving health and saving lives and doing all that. But if we, stop all hospital activities for 3 weeks, waiting till the surge to come 3 weeks from now, we got another giant financial hole to fill, because we've got at a time when we're trying to double our hospital capacity in the state. And I've talked to people last night and today that are looking at that they're going to have too much workforce, and they're even thinking about, do they furlough people or what do they do on their staff between now and the surge, because their demand has gone down so much. And so again, part of it being here in North Dakota, when our peak is going to come later than other states, we want to act proactively, but we don't want to act prematurely, because if we act prematurely, then we can also do economic damage to those families who earn their livelihoods working in healthcare, and we can also do health damage to the people that might have been, quote, getting an elective surgery. So we're trying to balance those things, and in this case, a one-size-fits-all order from the state made no sense when we've got a bunch of responsible leaders that are managing and making those decisions on their own. And again, I think as we get more positive cases, we're going to see that the public itself is less eager to go in for any kind of appointment. I mean, one of the clinics that was on the phone today said they were, normally do about 80 visits a day in one of the rural clinics, and they're seeing about 20 patients, and they're in a county that doesn't even have a positive test yet. And so so the demand drop has been severe for current healthcare stuff, and so I don't think there's nothing maybe other than some optics around mandating eliminating elective, because market forces are taking care of that right now, and we want to help keep our healthcare sector as strong as we can, both now and also coming out the backside.
Going back to the Workforce Coordination Center now, I think we can all infer how people working in healthcare and childcare would be really useful in this kind of situation. How would people in the ag, media, and energy sectors, for instance, help out here?
Well, let's just say we've got a situation in ag where we got to get crops in this spring, and a number of folks in North Dakota use labor that comes from overseas. Some that comes from Mexico, some comes from South Africa. They come to North Dakota on H-2A visas, and the reason why that labor that is based on people that immigrate to the United States seasonally. They often come back and they're driving, sophisticated equipment for some of North Dakota's best and largest, farmers. And the reason they're doing that is because the labor market's been so tight in our state that getting someone to work in a ag-related job versus many of the other jobs that we had in the state has always been difficult. And so we could actually have people that if the H-2A people can't get here because of issues related to quarantine or immigration or the labor there, then they're going to have to tap into a labor market here. So if somebody here who might find themselves without a job, when we were on the ag producers yesterday, and I would say to anybody that's sitting at home that doesn't have a job right now, if you want to get a job doing spring work on a farm this spring, there's probably a lot of people that would want to hire you because we're going to have a shortage. We could have a shortage of labor there. So that's an obvious example for North Dakota. James, welcome back.
Governor, the FDA recently relaxed its rules to allow ethanol plants to produce this hand sanitizer. Are those the vendors you were talking about? They also must get approval first.
So the question, I want to make sure everybody heard it, was that FDA recently involved ethanol plants to do this. I know in other states like Iowa, some of that is taken on, is happening. Not aware that is happening in North Dakota. I mean, one thing I do know about ethanol right now is that ethanol is really tied to the oil markets, and when oil is approaching $20, it's really hard for anybody. It's probably a money-losing proposition to be trying to make ethanol. I heard that Poet, one of the largest ethanol producers in America, yesterday headquartered out of South Dakota, has stopped buying corn. Not a good sign for the people that have got corn in the bin. But I would think that the bigger issue facing ethanol plants right now is the same as during this oil crisis, is can they keep their doors open versus can they convert? Now, if they thought maybe there was federal money, maybe this is an alternative product that they could be producing during this crisis. Maybe some will think about shifting their business models. But some of the folks that we were talking about is actual distillers in North Dakota that could shift their production over to this. I'm going back to online and then to Lane Hinkins after online. Danny?
Matt Henson with WDAY. Golf courses are supposed to open soon. Would you consider allowing golf courses to open in North Dakota?
Question is, will we consider having golf courses open? I think they are open, and right now we've got there's no plans to close golf courses. This is a nice outdoor activity where, and if you golf the way I do, you will never be within 6 feet of anybody else. So you'll really be keeping your distance from people. But we'll keep those going. Lane?
Someone got in contact with me saying that taxi services in town aren't running, and they wanted to know if there was anything preventing them from running, or if that was their own choice, and if there's any alternatives.
Question was taxi services not running. There have been no restrictions that I'm aware of that would stop, taxi services from running, and so that must be their own business choice on that front. I do know that there are, other services, around the country, and where you got Uber and Lyft, where those guys they're delivering food instead of delivering people. So having that. Through Uber Eats or Lyft has got a similar product, but I mean, I think that again, there's certainly, and if we're getting people to stay at home, there's an increased need for big demand for delivery services, and so if those companies are hauling less people, maybe they could haul more product as a way to, have their business actually be growing during this time period as opposed to shrinking. But again, these are private sector businesses. They've got to make their own choices about their staff and their labor. But I think, like we talked about, public transportation, not a bad idea if for a driver in that situation, probably to be wearing a mask, just like the bus drivers in public transportation or metros, I think, are also being provided with, some personal protective gear. Okay, I'm going to go down the line this way, so I'm going to go counterclockwise. So Jeremy, Amy, Jacob, Dave. Does that work? Okay.
I have just a couple of semantic questions here. You've shown the testing by county graphic a couple of times now. Are those data reported based on where the tests are performed or based on the mailing address of the people being tested?
Mailing address of where the people that are tested. So you could be tested in Cass County, but if you live in a western county in North Dakota, that's the address you put on your test. We disclose the county in which of the county address of where the person listed when they're thing. They may not have been there and may not be living there now, but they may consider that their home address.
Okay, and then just one more, the number of cases, the number of total cases, that includes the number of people who have recovered and the number of people who have died from COVID-19, right?
Correct.
Question about hand sanitizer. You said that people should hold on to their hand sanitizer bottles. Is that because you're envisioning people actually like mailing their hand sanitizer bottles to a producer of hand sanitizer to fill? Or are you thinking more that maybe there might be some central locations where hand sanitizer would be dispensed?
So the question relates to the vision for the hand sanitizer supply chain and bottle refilling. I don't have all the details on how that would happen, but I'm delighted that you're thinking that through, Amy. That's fantastic. But we do know that we have the ability in our state to create the product, but we do not have any bottle manufacturers, and particularly the pump manufacturers. So that's the thing that when we solve the one problem, then we'll have another problem, which is, hey, how do I use this in a reasonable way? So that's why we're asking people. But it might be that we, have spitballing here, which is not something you want to do because that might spread the germs. But if we had a drop-off, say, for example, where people drop them off, we could sterilize them and give them back to people. People could donate their old ones. We're just asking. This is one way where people can participate and help out, because hand sanitizer is probably going to become a bigger part of our lives going forward, particularly if we are concerned about a rebound of this coming next winter. Again, we may be practicing better hygiene for some period of time, so we want to try to do what we can during this period of shortage.
Do you all have a feel for how many distilleries in the state are looking at potentially making hand sanitizer?
I don't know that, but we can ask. Could do that. But I would say on the thing on, as I said before, my parents have both passed, but they both were, born in the teens and lived through the Depression. They lived through the, World War II, and when my dad was off on a ship in the Pacific for 2.5 years, and mom was back here stateside, I mean, they had all kinds of things that either you got rationed or you saved or you brought to centers to get recycled or used, and that was an ethic that stayed with her whole life because of that idea about conservation and reuse and whatever. And it's very popular today with our youth when they think about particularly when it comes to plastics and preserving the environment. So here's a chance for everybody to get involved and really again, where you're doing something that not just helping the environment, might help save lives. So again, we hope that people can find a spirit of community and collaboration in this simple thing that we're launching. Okay, Jacob, you're up.
Slightly less delightful question. Nearly 25,000 claims for unemployment, a lot of them in the energy sector where a lot of people are moving around. How do you see this kind of thing affecting the census and federal dollars in North Dakota as a product?
It is a question around that I'm concerned about the census, because in 2010 we missed counting a lot of people that were working here in 2010, and when you undercount, as we've talked about at previous briefings, every person we undercount, that could be $19,100 worth of lost revenue that we might be getting from the federal government over the next 10 years. So the census is still happening. The census information, again, someone can get to me so we can give a shout out again on where to go for that. But you can, for the first time ever, because you couldn't do it in 2010, you can complete the census online. And if you complete it online or by phone, great news. No one will show up at your door trying to count you or how many people are in your household. And so again, if you are here in North Dakota right now, whether you're employed or unemployed, whether you're whatever it is, if this is where you live, please take the time to do the census. Now I'm going to try to lip read. 2020census.gov is where you need to go. 2020census.gov. If you're in North Dakota, you count. Go out there and be counted. Fill out the form. It's quick. It's painless. No one will come. They might come if you don't fill it out. Because we're trying to find everybody. And if you've been mailed something already, then you've got an opportunity to also complete it by mail and send it back in. They're still taking it by mail, but if you are not interested in doing paper these days, you can do it online. Okay, Dave?
The neighboring state, Minnesota, has been hearing a lot of complaints about price gouging during this whole thing. Have you had any complaints?
Question, if we heard any complaints about price gouging. I have not had any price gouging concerns directly brought. The only one I would say is the one that we know through the federal government that's been raised, that came up on our call the other day with agriculture, which is we've got and I've maybe mentioned here before, but we've got this discrepancy where we have the cattle future markets and the daily price is down, and boxed beef prices on the future markets is up, and what's in between. I think there's only 2 or 3 big national producers that are involved in the beef processing, and there have been some formal requests. I've heard, from one group, I think they'd asked both senators in North Dakota and both senators in South Dakota. One of the South Dakota senators may have made a formal request to one of the federal agencies to do an investigation around price fixing between those players, and so there's been that has been raised formally, but that doesn't mean question's been raised. Doesn't mean it's going on, because there's a lot of dynamics going on in the market right now. But the other thing which I think that is been I've heard from other governors is that there's been a wide range of what people have been paying for N95 masks, and some of that is it supply and demand. Some of it's supply and demand. You throw a lot of money at medical equipment, and it goes up. I mean, we throw a lot of money at housing before the housing crisis, and housing prices inflate. We throw a lot of money for the last decades at higher education, and tuition goes up. You throw a lot of money at medical supplies, the prices are probably going to go up. So there may be claims of that, but I mean, we're in a country that operates tries to operate with markets, because markets are the most efficient, but there will be price inflation when you've got demand and you've got liquidity to chase those products. Okay, I'm going back to Danny and then to Lane.
Robin Travers with 660 KUYZ in Williston. President Trump announced this weekend that federal guidelines would continue through the end of April. How accurate do you feel this extended timeline is for North Dakota?
Question related to the federal extension to April 30th and how accurate it is for North Dakota. I think for people that are following this closely, understand when we've showed the slide before of when the peak is going to be, and then we're on the downside, and we're trying to keep our curve flatter, but everybody's still going to have a peak in terms of the cases. Our peak's going to come later. So that may be the right date on average. Maybe it's the right date for the East Coast. We'll have to see where the Great Plains states that are trailing the two coasts, whether that date is the right date or whether that date is too early or too late. I mean, we'll have to see, because our experience, every state's individual experience will differ. And here's 2 cases why I say it could be early or late. If no one pays any attention to the social distancing, the keep physical distance rules that we have, then our peak will come sooner. If we practice the good rules, we'll save lives, and the peak may come later. I mean, we may trail other places. That is, we're trying to learn from the other states and be more prepared than the other states. But it all comes back down to individual responsibility. So it's very hard in any of these models. You can take the most sophisticated model that you have, project when you think the peak is going to come in terms of number of cases, number of deaths, and demand for hospital beds, and underlying those pretty graphs and all of that data is going to be an assumption about infection spread and how many people who have it, how many more people do they infect. That's one of the most significant variables in any of those models, and no one can predict that, because you can't predict human behavior, because it's and so I guess we'll wait and see. We're hoping that we can outperform all those models, as we said yesterday, because we want to have fewer people die, and the sooner we can get this behind us, then the sooner we can get back to the new normal, which is something I think we'd all like to do. But I can't. The federal one is the federal. A federal date for the whole state for the whole nation is good guidance, which we support, but it's not, each state's going to have their own, the peaks will vary by each state, and that's why we have to look at our own situation in North Dakota. Lane?
This one's kind of a doozy, so I'm going to break it up into two parts for you. A man in Stanley contacted us and said that he took his son, who was really sick, to the local healthcare facility there, and they denied him a test of any kind. So he wanted to know why that is, or if they just don't have enough tests to be able to test for COVID in rural areas right now.
We have enough tests around the state, and we confirmed that. Some of the people that were on the calls today were low, but we've got the ability to ship more tests to them. Nobody was out. We're making sure that everybody knows exactly how to reorder through our automated ordering system, and also talked about things that we can do to tighten up when they do a test. They don't have to wait for tomorrow's courier service. We can speed things along and getting that through there. But the guidance that we'd given was vulnerable population with underlying health conditions. If this son was healthy and younger, wouldn't fit either one of those, because we know that the symptoms for COVID in younger people are generally mild. So the local provider might have made their own assessment of that young person's health and said, look, we're not going to do anything differently. Treat it like you have the flu. Go home for 14 days. Drink fluids. Watch your temperature. Call us if it gets worse. Don't interact with other people in case you could be infectious. But they probably felt that a test wouldn't have changed any direction that they would have given. And again, this is a deadly disease, 15 times more deadly than the flu for people that are older and have underlying health conditions. But a beautiful thing, and why the flu models don't work, and why this is different than the flu, is because this is sparing the lives of young people. And that's, I guess, one thing we can be thankful for about this. The full nature and character of the virus not understood, but it's clear from the worldwide data that you can get it when you're younger, but your likelihood of mortality is really, really low, which is a good thing. For anybody who's a parent, is grateful about that.
So then the second part of this was he felt that his son did have symptoms, and they told him because they didn't match symptoms and underlying health conditions to it, they would not test him. So him and a bunch of other people have asked us, what defines an underlying health condition?
Well, the underlying health condition that we're looking for would be things we've listed before. If you've got, a chronic heart condition, if you're diabetic, if you've been a lifelong smoker and you've got some kind of respiratory diseases, anybody that is, might have any respiratory disease, anything like pneumonia, all of those things are the things that they're looking for. And again, if somebody presents who's young and doesn't have any of those underlying conditions, in the past couple of weeks, as we've been trying to ramp up our testing, I'm sure that that's not the only otherwise healthy young person that may have been sent home without a test. Doesn't mean they couldn't be transmitting. That's why if they're presumed positive, we still want, even without the test, we're wanting to save those tests for people that might be going into a facility, because if someone is sick enough to be going into a facility, we really want to be testing them, because that way we can protect them, the other people in the facility, and the healthcare workers. But if somebody has got this and goes home and self-isolates, they're young and they're healthy, not much risk to themselves or risk to anybody else. If they go home and interact with a lot of other people and they get other young people sick who then get their grandparents sick, then it could. That's the chain reaction why we're trying to do the social distancing. But good question, thank you. Danny from online.
Renee Jean with the Williston Herald. Do you have a breakdown on what North Dakota will use the $1.25 billion from the CARES Act?
Question was, how would we use the $1.25 billion from the CARES Act? We have a breakdown. The answer is no. We should think about this as a pre-funded emergency account. When we have a flood emergency and we get a disaster declaration, and then we get reimbursements. We go to the townships, the counties, we get everybody and say, hey, what were your expenses that you used to fight this fight, and what qualifies? I'm sure that as this legislation has been passed, there's going to be more rules that are written that provide guidance around that. But what we've been telling everybody right now is keep your receipts. The state of North Dakota is keeping its receipts. If we only spend, a couple $100 million fighting this thing, we don't get to use that as replacement revenue for the state of North Dakota. This has been clear, made by other governors. This is not replacement revenue to replace our lost sales tax, replace our oil tax revenues. This is related to things that we did specifically to fight the COVID emergency, and that's what it's intended for. And so the things that we're doing right now, through the National Guard, through emergency services, through all that stuff would all qualify as expenses for this. But we'll, continue to watch that as more guidance comes out from the feds, but that's what we're doing right now. Is that sign language or a question, Chris? Okay, oh yeah, do you want to come up here and answer it? Thank you. Chris Jones has got a expansion on the prior question about testing.
Yes, so there is no change in the deadline for SNAP. All the processes are still the same. Want to let people know you can still apply online for SNAP. And then tomorrow morning there will be updated Q&As for all economic assistance, whether that's SNAP, temporary assistance for needy families, the energy program, as well as the child care development grant. So.
Thank you. We have one more online, and then Delane after that. Thanks, Chris.
Dave Kolpak with the AP in Fargo. Is the state currently seeking more ventilators?
From Dave Kolpak in Fargo, thanks Dave for the question. Are we seeking more ventilators? The answer is yes. We're doing that through multiple paths. One is through ordering. One of those, through our regular suppliers. One of those is through allocations from the federal medical cash, which they're working to build. And then the third is working with local manufacturers. Mentioned yesterday that that Appareo was part of a group. I had a chance to talk to Barry Batchelor, the CEO of Appareo in Fargo. They're part of a consortium that includes Toyota, Medtronic, Boston Scientific, and North Dakota's own Appareo that are working on an open source design to build ventilators. They've got a clean lab set up. They have ordered these open source parts to come in, and they're going to start manufacturing and hope to have some of those coming online. And these would be on the spectrum of super expensive, high end to keep you alive. These are on the bottom end of that, but there'll be likely be a emergency use authorization and EAU that the FDA would provide for these things, and this could again help in a life-saving way. So it's great that we got a North Dakota manufacturer that's working on a solution. But they plan to manufacture thousands of them, and so that would be more likely exceed the needs we have in North Dakota. But it'd be great to have one supplier building them here in state. Lane?
Mine kind of goes off of that. If there were to be a shortage of ventilators, if this spikes, is there a prioritizing plan in place for who gets ventilators? And does that also include people with mental or physical disabilities, or do they have their separate plan for them?
Lane's asking the question that we're spending day and night to try to avoid, which is what would happen if we got in a position where we had to choose who lives and who dies based on available beds and equipment, particularly ventilators. This is something that's been reported that was happening in Italy when their surge came, and this is what we're working day and night to avoid here. And it's my fervent hope and the passion that drives us and everybody on the team every day is that we do not want to put medical professionals who have dedicated their lives to saving lives in a position where they would have to make that decision. We want to be a spot where they're not going to have to make that decision, where we're going to have enough capacity to serve the people that are needed, and that's what we're doing. So that's my answer to that one, is we are not going there. Jacob?
My final question for the day, Governor. Oil is at $1.79 a gallon, been that way for a while now. Any concern that the state might not be able to get funds for road projects and other infrastructure?
Question is with the, with low prices, what does that mean, in terms of our gas taxes? I think our gas taxes are not based on percent. I think they're based on a fixed number of pennies. And so I think it's what's going to really hit us is not the low price, but the fact that people are driving less. We will have low gas tax collections. I think at least the automated traffic monitors that NDDOT shared with me a few days ago was that traffic was off over 30%. And so we'll see a decline in sales tax, see a decline in gas taxes, and we're going to see a decline in oil taxes for sure. But the biggest bulk of revenue that comes in the state is from the low oil taxes, not the low gas taxes. Some of the gas tax goes directly into a fund, the highway fund, which helps us build and do construction. If we have the resources, I have been asking NDDOT to think about what projects could we actually advance and do this summer that we were going to do in the summer of 2021. I'd like to see us do more construction. When we have a downturn like this, a severe downturn in the oil business, which we know will come back.
Thank you for joining us for the latest press conference on COVID-19 here in the state of North Dakota with Governor Doug Burgum, where you heard him confirm now 126 positive cases of COVID-19, as well as the 17, with the 17 new cases reported today. We're going to continue to bring you this press conference over on KXNet.com and over on Dakota's CW. Stay with us. We'll have KX News at 5 when we return.
Building, because it'd be another way to help the economy come back, as if the state was building necessary infrastructure, and I would support any and all plans where we would do that. Now you'd say, well, where's the money going to come from? Well, this would be the time. If there's ever a time to do bonding in the state of North Dakota, and you do it when construction prices are low and interest rates are near zero. I mean, this would be the time when we should be figuring out a way to, and we need to stimulate the economy. This would make a ton of sense for us to be bonding and building right now versus, hey, we'll wait till the thing's booming again and then we're competing with everybody for labor and construction materials.
How much authority do you have, Governor, to do bonding with the legislature not in session?
Question is, how much authority do we have? That's a good question, Dave, and something we're looking into, because under emergency authority we've got quite a bit of authority, but we've also got the Bank of North Dakota, which is could be, when I say bonding, it could be borrowing. And again, if we've got demand down in the Bank of North Dakota and the Bank of North Dakota's got extra capacity, that would be great. And there is some existing authority for the Bank of North Dakota through what SA State Investment Board. Some portion of their funding is available for infrastructure projects. We'd like to see that to be more, and that's certainly something we had it in our budget last time. Brent and I will have it in the budget again this time to try to expand that, because we think we could have a better revolving loan fund for infrastructure going on permanently. But if that was bigger right now, we'd be recommending using all the availability that's there. One more online, and then I think we're wrapping up for the day. But
Tom Simon with Trending Topics in Williston. The first 2 positive tests in Williams County were reported today. However, citizens in western North Dakota continue to worry about the policy of not releasing confirmed cases of non-residents. Would the state reconsider and include confirmed cases of non-residents in our numbers in some way?
Question is, would we consider releasing information on non-residents in our numbers? And this goes back to personal health information. So we are, again, from a state standpoint, we'll keep releasing which is in the law and what we have, which is gender, age, and the address that they listed on as their home address on the test. And we're going to continue with that practice that we're doing. And we hear the question, we get it every day. We'll keep looking at it, but right now, this is the plan that we have, and we're sticking to it. I think the underlying fear is, hey, there might be more people in our county that have COVID than what you're reporting. The answer to that question is yes, there are more people in your county that have COVID than reporting because we are underreporting by at least 10 days the positives, and we're underreporting based on the amount of testing we're doing. So the answer is people should be following the guidelines and acting as if there are many more cases than what we're reporting. So and it's not about, and I think the question said people are afraid. People should be realistic and understand that we should assume it's everywhere, and then people should act accordingly in terms of all of the hygiene rules, the distance keeping rules, the working at home, the stay at home. That's what we want to do. So if people are concerned it's out there, then that concern is accurate, and let's all, with individual responsibility, act accordingly. Again, in closing today, I just want to say again, thanks to all of you that are working to get great information out there to people in the state. Thank you for everybody that's listening online for all this, and thanks to all of the folks that are working. Again, having had those calls with both the large healthcare systems and our critical access hospitals leadership over the last 16 hours, I just want to assure everybody in the state that our healthcare system providers out there are working more collaboratively than they ever have. They're working more diligently than they ever have. They're working to take care and protect their own staff and their own team members. We're fortunate to have such a strong healthcare system in our state, and I know that they're going to do amazing things in the weeks ahead. So thanks to all of them, and thanks to all of you, and we'll see you tomorrow. Stay healthy.